A heart and a soul. A broken heart. A racing heart. No other organ inspires as many songs, poems, or letters.
Das Herz reagiert ganz sensibel auf
Our
das,
hearts
was
react
gerade
to what is
passiert
happening
und
at the
eben auch auf
moment
unsere Emotionen.
and to our
Das
emotions.
heißt, wir kennen das alle. Wenn wir
When we're
aufgeregt sind,
excited,
dann schlägt
our
das
heart
Herz
beats
schneller, dann
faster.
schlägt es kräftiger.
When we
Wenn wir
fall in
verliebt
love,
sind, haben wir
it flutters.
Herzklopfen.
Klar, Liebe ist
My heart
die
is
Emotion,
very
die ich
much where I
absolut
feel
durch mein Herz
love.
spüre. Ja, und
It
Aufgeregtheit.
beats faster when I'm
Klar, es
excited.
schlägt halt schneller,
I honestly don't know if that's healthy or not.
Ich weiß nicht.
Good question.
Das ist eine gute Frage eigentlich.
But our heart doesn't just express our feelings, it literally keeps us alive.
Wenn wir Angst haben, wenn wir
When
in
we are
einer
afraid or in an
Notsituation
emergency
sind,
situation,
dann macht das Herz etwas ganz
our
Tolles.
heart
Es arbeitet
automatically
einfach
starts beating
kräftiger
faster and
und
harder so we
schneller
can
von
respond
alleine,
faster
damit
and
wir
get out of the
leistungsfähiger sind,
situation.
damit wir zum Beispiel weglaufen können. Wenn wir auf unser
If we
Herz
don't
nicht
listen to our
achten,
heart and take care of it,
dann
it can be
das
dangerous in the
auf
long
lange
run.
Sicht gefährlich werden.
How can we know if our heart is at risk? And how do the warning signs differ between women and men?
Wenn man sich vorstellt, das Herz
The heart begins to beat roughly 21 to 28 days after conception.
Nach der Befruchtung zu schlagen und
And from then on, it
schlägt
beats
es
throughout our
ganz
entire
Leben lang
lives
bis zu
until we
unserem
die.
Lebensende. Mein Name
My name is Dr. Conchita Ruiz-Mohné. I'm a cardiologist at the Ports am Rhein Hospital in Cologne, where I lead the Women's Cardiovascular Medicine
Ich leite
Center.
dort das Zentrum für weibliche Herz- und Gefäßmedizin. Das Herz
The heart
das
is our most
zentrale
critical
in
organ.
unserem Körper,
It pumps
was durch
oxygen and
seine
energy throughout the entire
Druckleistung
body
den
to
ganzen Körper,
every
den
single
ganzen
cell.
Organismus, jede einzelne Zelle mit Sauerstoff, mit Energie
What's remarkable
versorgt.
about the heart
Und das
is that it
Tolle am
works
Herzen
very
ist, dass
precisely,
es ganz
tirelessly,
präzise
like clockwork.
arbeitet, wie ein Uhrwerk, unermüdlich.
Ich spüre mein Herz
I
im Alltag
usually
viel mehr
notice my heart
bei
more
starken
during
sportlichen
intense
Aktivitäten
sports.
oder sowas. Und ich würde aber
I
auch
assume
sagen,
that's
ich würde das
good.
als gut bewerten. Wir tanzen
We've been
seit
dancing since we were 3, more than 20 years.
Und tanzen hat sich
Dancing
immer nach
always
Freiheit
feels so freeing.
Und das Schönste war, dass
You
man wie
always
immer
have this
diesen
flow moment.
Flow-Moment hatte.
When you're dancing
Wenn
and
man
not
getanzt
thinking
hat,
about
an nichts
anything
anderes
else,
gedacht hat,
you feel
so
freer
frei
than
war,
you
wie man
ever
sich
have
nirgends
before.
sonst gefühlt hat. Ja,
No
keine
worries
Sorgen
at all.
hatte. Hey, ich bin Naomi,
Hi,
ich
I'm
bin
Naomi and I'm
29 Jahre alt.
29.
Ich bin Joëlle,
I'm
auch
Joëlle,
29
also
Jahre alt und
29.
wohne mit
I live with my
meiner
twin
Zwillingsschwester
sister in Berlin.
Berlin.
We live
Wir
in
wohnen
Berlin.
Hauptberuflich
We both
sind wir
work in
selbstständig
social
mit
media
Social Media,
as
also
freelance
arbeiten als
content
Content
creators.
Ich würde sagen, so unser
We
Hauptcontent
write
ist
mostly
eigentlich so
about our
unser
lifestyle,
Ja, unser Leben hier in Berlin,
living together as
zusammen
twins here in
Zwillinge,
Berlin,
zusammen
in a queer
im
household,
und auch
as
wir
dancers,
Tänzerin, du
you
als
with your
mit
art.
deiner Kunst. Aber ich würde sagen,
But the
am
most
meisten
important thing
Einzelsituation
is living as
als
identical
einer
twins
Zwillinge, so
and not taking ourselves too seriously.
Ich glaube, ich habe mir noch nie so groß
I've never really
Gedanken
thought
gemacht.
much about my heart health.
Tatsächlich nicht. Ich glaube,
I think I've
weil
never
ich
had any
einfach
symptoms
bisher symptomfrei
or never
war. Ich
noticed
hatte
any
keine Symptome, die
problems
darauf
with my
hinweisen,
heart.
dass es meinem Herzen nicht gut geht.
The heart is a fist-sized muscle that works around the clock to pump blood through the body. It consists of 4 chambers, and its rhythmic beating delivers oxygen and nutrients to the organs and flushes out waste products. At rest, an adult's heart beats about 60 to 80 times per minute. Each beat is made up of a systolic or contracting phase and a diastolic or relaxing phase.
Auch junge Menschen können Herzerkrankungen
Young people can
haben. Bei
develop
jungen
heart
Menschen
disease
ist das
too.
so,
But a young person can tolerate certain heart conditions for quite a long time and can therefore compensate for them. Often, they only notice the condition later.
Good morning, Cologne.
This
is exciting. Today we'll have all the tests and find out how our hearts are really doing.
Das finden wir heute raus, oder?
I think we both expect the tests to show that our hearts are healthy. We don't feel like anything is wrong. It would be really awful if something did come up. Of course, it would be good to find out, but we don't expect that to happen.
Good morning, I'm Dr. Ruiz-Mohné. Nice to meet you. I'm glad you're here.
When I'm cycling, I only feel myself. I only listen to my body. As soon as I'm on my bike, I forget everything else. I don't know what I would do without my bike. I don't even want to think about it. My name is Ferruccio Labita and I'm 46. 8 years ago, when I was 38, I had a heart attack. I have a cross-country bike, 2 mountain bikes, a dirt bike, and 2 commuter bikes that I ride to work, plus my gravel bike. I'm preparing for a competition called Seven Serpents. It's an off-road long-distance race. The route starts in Ljubljana, Slovenia, goes through Croatia, then from Croatia northwards, over the islands, back to Italy, and ends in Trieste. The event starts in about 2 months. I'll have to train a bit more before then. I had these sorts of goals 8 years ago, but hadn't known my risks. Before my heart attack, I spent most of my time working, sometimes 60 to 70 hours a week. I started smoking when I was 30. The main reason I did is that my first marriage broke up, and I was very depressed. So I started smoking.
When we smoke or get too little exercise or eat an unhealthy diet, it puts great strain on our heart. Over time, fat and cholesterol can build up as plaque inside the coronary arteries, the blood vessels that supply the heart with oxygen. The heart then has to work harder to pump blood through the vessels. The constricted arteries reduce the oxygen supply to the heart muscle. A heart attack is often caused by these plaque deposits rupturing, forming a clot, which completely blocks the coronary artery. As a result, the heart muscle in this area is starved of oxygen. Without rapid treatment, the heart tissue is damaged beyond repair.
The first time I felt anything was after I'd been at the gym with a friend. It felt like I couldn't breathe, as if someone was continually pressing down on my chest. First I lay down, then for the next 2 hours it was a constant roller coaster of emotions, pain, and wondering what was happening. When my wife saw me lying there suffering, she naturally said we had to get to the hospital right away to have me checked out.
Ich hatte einen stummen Herzinfarkt. Das war die Diagnose.
The diagnosis was that I had suffered a silent heart attack. They put 3 stents in to clear the arteries, which were 80% blocked.
Zu waren, wieder freigemacht. Ich kann es gar nicht beschreiben, aber
I can't really describe it,
sehr klein gefühlt. Ich habe mich sehr
but I felt very frail and vulnerable.
Nicht klein, aber sehr verletzlich gefühlt.
I didn't know what the future had in store for me.
Bedeutet, was auf mich zukommt.
Silent heart attack symptoms are not very obvious, so they are not often noticed. That's why it's called silent. But as soon as the words heart attack cross your mind, you should get checked. Even if you're not sure, call emergency services or see a doctor.
Die 112 rufen oder einen Arzt aufsuchen.
If someone is having a heart attack, one mistake is to do nothing at first. I'm Celine Killian. I'm studying medicine and have been a paramedic for 6.5 years. Every day in emergency services is different. And I think that's why you either love this job or hate it. Because you don't know whether you're going to be called to perform CPR or treat an ingrown toenail. If you suspect someone is having a heart attack, the basic rules are to remove any tight clothing or ties so they can breathe easily. Lay them down with their upper body raised and open a window to let in fresh air. That always helps and calms the patient. If the patient's heart stops due to a heart attack, it is very important to first speak to them loudly and clearly. Grab them by the shoulders and shout. If they don't respond, step 2 is to check their breathing. Watch for 10 seconds to see if their chest is rising and falling, or if their nostrils are moving. If not, call the emergency services right away and start chest compressions. Place your hands on their chest, make sure their arms are out straight, and then press down 30 times, about 5 to 6 centimeters, 100 times per minute. Press to the rhythm of Staying Alive.
Staying alive singen, also aha, ha, 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 staying alive, staying alive.
We get more calls for men having what is later diagnosed as a heart attack. In my experience, I would say 2/3 are men and 1/3 are women.
Heart attacks in men often show the classically known symptoms: severe, heavy pain in the chest that radiates to the arm or jaw. These symptoms are unmistakable and quickly set off alarm bells. In women, heart attack symptoms are often much less clear. They may complain of nausea, extreme fatigue, shortness of breath, or dizziness, symptoms that are often confused with stress or other illnesses. Chest pain is less common and may be diffuse or only mild.
Und dann kann es passieren, dass die Person
And then her partner
dass
might
der
suggest
Ehemann,
she
die
lie
Ehefrau, die
down and
Partnerin,
sleep
der
a bit.
Partner,
And then
dass
maybe
sie
she
ihm
will
sagt,
feel
"Ach,
better."
Schatz, leg dich doch noch mal ins Bett, schlaf
But
noch
that
mal eine
is
Runde und
dangerous,
vielleicht ist es gleich ja wieder
because
gut.
critical
Und dann
time
ist
is
genau der
lost.
ganz gefährliche Moment,
While
wenn
the
hier
woman
bei
is
ihr
laying in
Zeit,
bed,
wenn die
heart
Frau
muscle
sich jetzt
tissue is
wirklich in
being
das Bett
damaged.
legt, dann geht in dieser Zeit
That is also why women arrive at the emergency room much later than men when they have a heart attack. On average, they arrive at the emergency room 3 hours later than men when they have an acute heart attack.
In der Notaufnahme an als ein Mann.
Who's first?
Your name is first on the list.
To identify potential risk factors for your cardiovascular system, you should have your blood fat levels checked. It is especially important to check your cholesterol levels and other blood fats, like triglycerides, to identify any major risk factors.
Triglycerides and cholesterol are blood fats that affect the heart very differently. When we consume more calories than we burn, the body converts the excess into fat and stores it in the blood as triglycerides. But too many of these can strain the blood vessels and the heart. Low-density lipoprotein, or LDL, is often called bad cholesterol. It's a real troublemaker because, over time, LDL deposits build up on the inner walls of blood vessels, obstructing blood flow and potentially causing serious heart problems. High-density lipoprotein, or HDL, on the other hand, is known as good cholesterol. It cleans the system, collecting excess cholesterol and transporting it to the liver to be broken down. Bad LDL cholesterol is primarily found in animal products like red meat, sausage, baked goods, full-fat dairy products, and fried foods. To reduce LDL levels, eating lean meat, fish, healthy fats, and plant-based products is recommended.
I'm going to darken the room so I can see properly. You can lie down now. First, I'll look at the main carotid arteries. There are two of them, one on each side. If plaques have already formed here, we will be able to see it at an early stage. To assess your own risk of cardiovascular disease, ask yourself, do I smoke? Do I get enough exercise? Am I overweight? Do I eat a healthy, balanced diet? Do I use drugs? That is also a major risk factor. Ask yourself if you or anyone in your family has any other health conditions. Have you ever had a medical checkup? The artery wall is very soft. Looks very good. Enough blood reaches your head.
Good to know.
Turn your head toward me. Now I can see your carotid arteries again. Looks good. To check your heart health, it is important to have a cardiac ultrasound. That lets us see the heart in its entirety, both its structure and its function. Here you can see the entire heart again, the left and right ventricles, the left and right auricles. I'm looking at the inner wall of the heart, here, to see if it's contracting properly everywhere. If there was a circulation problem in the heart muscle, then an area here would no longer contract properly. But this looks very good.
You see your body differently after these exams. Your carotid artery, your heart, and so on. You somehow develop a closer relationship with your body. You realize just how valuable it is and how much it does for you, and how good it is to be able to have these examinations done regularly.
Now comes the stress test. I need you to ride the bike and we'll see how your heart does under exertion. We'll have the recorded images on one side and the live image on the other. And if anything changes, we'll see it immediately. Because you're the same age, you need to reach the same target heart rate.
That was 160 or so, right?
160, let's go.
This is really easy.
My turn to ride.
You're doing great. Everything looks good here. Your heart's pumping well. Just a little more up the hill. Just a little further. Great, you're already at 150. Pedal, pedal, pedal. You can do it.
Oh, God.
A bit more, 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 more. 160. Very good. 161. And you can stop. Well done. Do you feel any discomfort? Pressure in your chest? Tightness? A pulling sensation anywhere?
No, not at all.
Everything looks very good. Now we just need the lab results. Joëlle, let's look at your cholesterol and blood fats. Your triglycerides, that's blood fat, are very low. That's a really good level. Naomi, when we look at your levels, we can see that your triglycerides are raised. Did you eat something very fatty yesterday? French fries or something? That could affect the level.
I ate truffle pasta and it was quite oily.
That could have affected it. Both of you have slightly raised LDL cholesterol, but I'm not too concerned about that. You don't have any other risk factors and everything else looks great.
I'm not happy that my triglyceride level is so much higher than yours. But otherwise, I'm relieved.
We are still waiting on the lipoprotein A level from this morning. We won't get the result today, but once we have it, we'll discuss it together.
Okay, yeah.
Lipoprotein A, or LPA for short, is a special type of cholesterol in the blood. A high LPA level promotes deposits in the arteries and narrows the blood vessels, increasing the risk of heart disease and stroke. The problem is that the LPA level is largely determined by genetics. People with high LPA levels have it from birth. Unlike other types of cholesterol, such as LDL, it cannot be lowered through a healthy diet or exercise.
The doctors found that my LPA was twice the normal level. I never thought about it being genetic because I never thought my cholesterol was too high. It was high, but I didn't think it was anything to worry about. You don't normally think about cholesterol when you're young. After my heart attack, it took me about 3 years to regain confidence in my body. For the first 2.5 to 3 years, I was afraid every day. I actually had panic attacks and had to start behavioral therapy, which helped me cope.
After a heart attack, patients often feel anxious and may develop an anxiety disorder or panic disorder. They fear having another heart attack and even fear they can no longer cope with life.
My name is Christiane
Waller. I am the chief physician for psychosomatic medicine and psychotherapy, and I am also a cardiologist at the Nuremberg Medical Center and University. Psychocardiology is the interaction between the psyche and the heart organ. My colleagues and I see those patients with cardiovascular disease or those with complaints where cardiologists cannot quite find a cause. Patients regain trust and confidence in their bodies when they realize that it is functioning again, that it is resilient, and that this is mostly a state of mind.
I'm now in Ljubljana, where the Seven Serpent race is starting. There are 150 people here. Now we're off to Trieste, through thick and thin. The ride won't be easy. I think the difficult sections will drag on, and it will depend on how mentally fit you are. I'm not thinking about my heart at the moment. But when things get tough, I'll be very focused on it.
If Pharaoh notices that it suddenly becomes much harder for him, if he feels pressure or pain in his chest, then he should quit the race and have it checked out.
My heart is beating faster than usual, so I'm already excited, just because of all the people and the fact that I'm the center of attention here. I've never ridden this race before, so it will be exciting to see what lies ahead.
Strong emotions are not bad per se. In fact, they are good for the heart. The important question is how to calm down from strong emotions. We know that interpersonal stress is the hardest for the heart. It's not the stress of your car or washing machine breaking down again. We humans are extremely sensitive and biologically wired to want others to like us, to be attentive to us, to support us, to be there for us. When that is in question at different stages of life, it becomes a source of stress that can negatively affect the heart. Blood pressure rises, heart rate increases, the heart prepares itself for danger. And if this stress response is permanently activated in the body, then the body is constantly in a state of chronic inflammation.
We stress each other every day.
Really?
Sure, about small things we forget right away.
What I find interesting is that sometimes, when we are both experiencing stress, we take it out on each other.
Yeah, we project our stress onto each other. That isn't healthy either.
When interpersonal stress affects the heart, we know that stress hormones are released continuously. But we also now know that other hormones play an important role. One of my research areas is oxytocin receptors.
Oxytocin has a very positive effect on our bodies. It's often called the cuddle hormone because it's released during times of closeness, intimacy, and interpersonal connection. Oxytocin is important for the heart because it binds to special receptors on the heart muscle and vascular cells. The result is that blood pressure and circulation improve, the heart is relieved, and the whole body relaxes.
We have the highest oxytocin levels in our blood when we have just fallen in love, even when another person, partner, child, or baby touches us. Whether male or female, we have the same system and the same ability to release oxytocin. It is also released in large quantities when we orgasm.
For me, being happy is often tied to other people, like when we hang out together, when I spend time with my girlfriend, or when we're on vacation together. The more stressed I am, the unhappier I am.
The key is to learn how to deal with stress in a healthy and effective way. If you do simple breathing exercises when you feel stressed, you'll notice how your body becomes calmer, your pulse slows, and you start to relax.
Freediving just makes me feel balanced. Water is a good mirror for how I really feel in that moment, not how I tell myself I should feel. That's why water helps you let go in those moments. My name is Anna Karina Schmidt. I'm 37. and I'm a free diver.
Ich bin Freitaucherin. Beim Freitauchen,
when you free dive, you dive with just one breath. That means you take a deep breath and then dive to the depth you want. My warm-up routine consists of meditation and a very gentle form of yoga. It usually includes the 1-minute breath, which is a form of meditation that comes from Kundalini yoga. One breath takes a full minute. I breathe in for 20 seconds. Hold my breath for 20 seconds. And breathe out for 20 seconds. The 1-minute breath helps to calm down or remain calm and enter a meditative state where we can really focus and listen to ourselves.
The vagus nerve is part of the parasympathetic nervous system, which is able to put our body into a state of rest and relaxation. Specifically, the vagus nerve ensures that fewer activating electrical signals are sent to the heart muscle, which slows the heart rate, lowers blood pressure, and relaxes the body. Controlled, slow inhaling and exhaling can stimulate the vagus nerve.
The water here is 42 meters deep, and I dive to the bottom with one breath and one flipper. I'm fit. My heart rate monitor is showing my pulse at 78. During really deep dives between 60 and 80 meters, and depending on the water temperature, your pulse can drop significantly, even down to 30.
Freedivers stay underwater for as long as possible without taking in new oxygen. The oxygen reserves that were replenished in the body before the dive are slowly used up at depth. The heart rate slows, the pulse slows, and blood pressure goes down in order to consume as little oxygen as possible during the dive.
It's essential to focus intensely on abdominal breathing before diving. We really want to find complete calm, just like right before falling asleep. You feel the water on your skin. You breathe in this specific rhythm. You equalize the pressure. You dive. And suddenly, you're in that moment, and your body knows exactly what to do. And then you're released. When you're diving, it's very important to be aware of how you feel on that particular day. Just because you dived incredibly deep or well yesterday or the day before, that doesn't mean you will do just as well the next day. Yes, I feel that I'm in a good place now, and that I was very relaxed. What free diving has taught me is that nothing you do is in vain. At some point, this moment comes when you feel the yoga you've been doing, the meditation, the focus, but also the strength training and the hours in the gym. And then it all comes together during some workout at 6:30 on a Tuesday morning. You suddenly realize you're really in the flow. With your body and your surroundings.
Das läuft einfach.
Even after a heart attack, you can still do sports. In theory, even competitive sports. Of course, this depends on how severe the heart attack was, how much heart muscle tissue was damaged, and how well your heart functions after it.
I rode right through the thunderstorm. It rained buckets. Not exactly pleasant. I'm okay, a bit tired. I only slept for 2.5 hours. We've been on the road for exactly 5.5 hours. Those were real mountain passes. We had to carry the bikes for a long time, which was exhausting. My heart is actually doing quite well. I've had to do some breathing exercises now and then because it does get a little difficult at times. Now I need a coffee.
Genau. Okay, here you are, and double espresso.
Ja. Mhm. Hallo?
Hallo.
Hey, Conchita.
Hey, Conchita. We can't see you.
You still can't see me?
No, not yet. Ah, now.
Can you see me now?
Hey, Conchita.
Hi, Conchita. Hi.
I'm glad we can talk again, because we were still waiting for the lipoprotein A results. The LPA is primarily determined by genetics and is a risk marker for cardiovascular disease. The results show that you both have elevated levels.
Oh, wow. Okay.
I know it's a shock to hear that you have a risk marker. But what this result tells us is actually a great opportunity, because now we can minimize the risk as much as possible.
Okay. Yeah.
I would strongly advise you not to start smoking under any circumstances. That is very important. I would recommend having your carotid arteries checked regularly, as this will reveal any early signs of plaque buildup or thickening of the artery walls.
Yeah, okay.
Yes, okay. It's good to know there are ways to deal with it.
There are lots of people out there who don't even realize they carry this risk. But once you know, you can manage it. And that's the silver lining.
Okay, thank you, Conchita. Bye.
See you again. Bye.
Ja.
I think once we've had time to digest it, we'll be glad we had the chance to learn about all this and have all these examinations.
To be honest, during these tests, I sometimes thought it would be boring for people watching because our results were good and everything went well.
Yeah, we're young, with relatively healthy lifestyles, but we are still at risk because of our genetic makeup. It's a good reminder.
Guter Reminder auch.
For me, racing is a way of pushing boundaries, of pushing my body to its limits. Now that I have better control over my body, I'm no longer afraid to push past those limits. Seven Serpents 25. I feel great. I'm really happy that I made it through after 4 days and a few setbacks. My heart actually did pretty well during the race, except for the first 2 days when it was really hard going. After that, it just took care of itself. And the last 2 days were pretty good. Now I'm looking forward to a shower and lying down for a while, because my back is a bit sore. But otherwise, I'm doing very well.
The heart is the hardest working muscle in our body, and yet it never complains of muscle pain. It quietly and reliably powers our lives, especially when we are young. The heart only warns us when it has no other choice. Over the years, we have learned that healthy eating, exercise, and not smoking are not enough. Our genes also play a role, meaning some risks are inherited. This makes it all the more important to listen more to our heart. It needs emotional breaks. People with whom we can laugh, cry, argue, or just be quiet. Times and places free of pressure. We need to quiet the inner noise and feel what really makes our hearts beat.